Hello, everyone. A very good morning, good evening, good afternoon to everyone who is attending today's session. I'm Dr. Taskin and I welcome you all on Homeopathic Musings. Today is going to be the sixth episode of our series ABC of Remedies, where Dr. Prajakta Vaidya ma'am will be talking about the remedy Staphysagria in detail. But before we move on to today's session, I'll take some time of yours and I'll quickly brief you through the ongoing courses on our platform. So this year we started with the animal series, as most of you might be aware, and we started this in January, and we hope to learn the 8 different groups of the animal kingdom. This month we are going to be talking about the group mammal. The live session will be on the 29th of July, and you can always register for this course. In case you are interested in full series, you can do so. If not, you can choose a la carte for any of the interested group that you want to join. Another important and very interesting series that we've started is Muse with Master, where Homeopathic Musings is going to give starting an initiative where you can ask anything to your masters. And in the episode 1 of Muse with Master, we have Dr. Ajit Kulkarni sir, who will be taking a 2-hour session on 20th of July, which is a Saturday, sharp at 7 p.m. IST. This session is going to be free of cost, so you can register for the same. In the second episode of Muse with Masters, we have Dr. Dr. Mahesh Gandhi sir, who will be there with us on the 22nd of July, sharp at 7 p.m. He'll be talking about his latest book, Chakras. We have another interesting course coming up, which is on the metrodonal remedy that will be taken by Dr. Ghanshyam Kalatia sir. This will be starting on the 1st of August. We have total 8 sessions for this course, and it will be sharp at 7 p.m. We have another interesting webinar on the 16th of August with Dr. Dinesh Chauhan sir, who will be throwing some light on the autoimmune disorders and its management in homeopathy. We also have Dr. Adil Chintanawala sir, who will be taking a session of 2 hours on the 10th of October, and he will be talking on the homeopathic approach in cardiovascular diseases and its management. Before we move on to today's session, I quickly brief you through the basic hygiene factors. So please, I request you all to keep your lines mute all the while the speaker is speaking. In case you have any questions or queries, you can write it in the chat box and we'll address it at the end. Do keep your videos on for an interactive session. Do not scribble on the screen. Make sure you make notes and share your experience. In case of any difficulties or queries, feel free to contact us on the below number. I'll quickly stop sharing and I'll hand over to ma'am.
Yes. So thank you, Taskin. And the courses which are coming up are very, very interesting. And I highly recommend all of you to join and, take the benefit of it. Yeah. Okay. Let me go ahead and share my screen. Okay. Is it visible? Okay, so today's remedy is, I think, very, very interesting, very important, and very useful in our practice. Huh? So we'll learn this remedy in detail and what is the main idea Okay, what is the central, themes or central feeling of this remedy, which we can match with our patients? Okay, so let's study it that way. And I again want to emphasize on when you're reading any remedy or any studying any remedy, just uh, you know just don't read or by heart the symptoms, or just mugging up things or remembering things, because that will not help in the long run. Okay, so when you study a remedy at depth from all the aspects, and I think it's very important to learn from all these sides, like how we understand our patients from the all the aspects. So that way we should also study the remedy from all the aspects. Okay, there are various authors and various things about this remedy, is being spoken about, and lot of good material is also available. So maybe at the end of the session, after this session, we can recommend you to read from different authors. What I wanted to do today is to work on the central themes, and basically to show how to study a remedy. Okay, so let's go ahead. I think the next slide which I'm going to show is going to give us the entire idea of this remedy. Okay, so when you say Staphysagria, okay, we know that it is from the, what kingdom does it belong? In kingdoms, if it is the plant kingdom, if it is a mineral kingdom, or if it is an animal kingdom, what are the suborders or subgroups that this remedy belongs? What are the importance of that subgroup? Because those qualities or those themes will also be present in the remedy. Now, coming to Staphysagria, let's go step by step. Okay, so Staphysagria, it is the remedy, as all of us know, it's from which kingdom? Plant kingdom, right? And people who are beginners here, uh, there are three kingdoms that are, it's, our remedies are prepared from: the plant kingdom, the animal kingdom, the mineral kingdom, and then there are other like the nosodes and sarcodes and imponderables are also present. So, what is the main idea of this plant kingdom? How do we identify? Okay, it's very important to identify. No? It is a retrospective study, right? So, how do we understand that this patient who is talking to us will need a plant remedy? So the main idea of the plant kingdom, where you see through and through, is the sensitivity of their patient. Sensitivity to many things. Sensitivity to, at the level of emotion, sensitivity at the level of the physical complaint, sensitivity in terms of change in the weather, change in the environment, and how this change or this sensitivity, how does all these things affect? Okay, so there is sensitivity and the reactivity to it. And that we will see that in terms of the cases. Also, we are doing a lot of basic, understanding of these kingdoms and the fundamental levels. How do we come to plant kingdom? In our other courses, the coming up course is this basic course that we are coming up. We'll teach you there how do we identify the plant kingdom. So who are the beginners, or who are new to this method, can join that and to understand how we can differentiate the kingdoms. Okay, then this plant kingdom is further, they are divided into the dicotyledon and the monocotyledon. Okay, now the dicotyledons further is divided into 6 groups. Okay, for time being, you remember only this much, that dicotyledons are divided into 6 subclasses. I'll show that in the next slide. there is Dr. Mikhail Yakir, who has worked a lot for the plant kingdom and the plant remedies to put them into order, okay, so that it is easy to study and understand, like how minerals cases or mineral remedies are easy to understand because they are in the order. So there's a lot of effort that has been put, and she came out with these 6 subclasses, and Dr. Gandhi further developed it and used this personal evolution method to identify these plant remedies in the patients. Okay, we'll study that little bit detail in the next slide, but we are doing that at very depth level in our other courses. Okay, so dicotyledon and the Staphysagria belongs to the first subclass of the that dicotyledon chart. The name of that first subclass is magnolids. What you can see here. Okay. Now, so this generals of subclass. So the magnolids will have some themes, okay, which will be present in Staphysagria. Then it belongs to the order Ranunculales. So in magnolids, there are different orders, okay, laurels, opiales, ranunculales, like that. So Staphysagria belongs to Ranunculales order, okay, and it belongs to, in Ranunculales order, it belongs to a family, that is Ranunculaceae. In Ranunculaceae, there are different remedies. We what very common remedies we know: aconite, pulsatilla, Staphysagria, simicifuga. Yeah, we know these common remedies which are there. So what I'm trying to put a point here, that Staphysagria will patient to whom you are prescribing will have the sensitivity and reactivity, which can categorize them into plant kingdom. We'll have themes of magnolids as a subclass, themes of ranunculales, which is an order, and of themes of Ranunculaceae, okay, as a family. Okay, what are these themes? We will study little bit of family today and little bit of ranunculales order, because at depth we are doing it in the other courses. Okay, so this is a chart. Okay, this is further developed by Dr. Mahesh Gandhi, and if you see over here, this is the first subclass which has ranunculales at the school age and adolescence age. This whole order Ranunculales has different families. Ranunculaceae is one of them, where Staphysagria belongs. Okay. At this time, you remember this much for the beginners. So let's go ahead. Let's study a little bit of one step down of Staphysagria, that is Ranunculaceae family. What are the themes of Ranunculaceae family? So they are also called as the buttercup family, and there are many species, around 2,250 species in 62 genera of these flowering plants. Okay, and they are distributed worldwide. Okay, and they have like they different temperature regions. You will be able to see them. Their flowers are often showy with 5 or more petals. The leaves are arranged alternately along the stem, and they are used as a lot of this for the for decorative purpose or ornamental purpose they use. So these are some remedies: aconite, clematis, ranunculus pulposus, nigella, and the other Staphysagria and other stuff. And what are the economic importance? So a lot of condiments, spices are made from this. The medicinal properties like the Aconitum napellus, okay, and it is specially used for the acute and inflammatory diseases, okay. And then this Talictrum, which has some alkaloid, which is used in this ophthalmium, lot of complaints of the eyes. And The pulsatilla one is used for feminine diseases and gastric derangement. And we know pulsatilla is a very good remedy for all gynecological complaints. And then ornamental purposes also there. So these are the remedies. Now, what is the main sensation of ranunculus C and how it is, derived? So this work is mainly done by Dr. Shankaran sir, and it is all given in his plant books. And I wanted to, put forward this so that we understand Staphysagria and ranunculaceae in much detail. Okay, so when he found out the rubrics, okay, which contain more than one emotion, like the anger with grief or anger with fright, or lot of, all emotions are felt intensely, anger with trembling, and anger with loss of speech. Okay, so there was a rubric which has lot of more than one emotion, and there were lot of, psychosomatic manifestation, that with any mental condition of anger, grief, there will be some expression at the level of the physique, that is the on the body. So there were a lot of psychosomatic expressions which were there, more than one emotion in one rubric, and most of the remedies will have that. And there will be, and in the remedies what he saw, that one emotion will be prominent and other emotions will be suppressed, not suppressed, but it will be at the lower intensity there. But if you see these remedies, there will be a lot of these emotional, emotional expressions will be there. So, as if now, if there is a person who experiences anger with, say, silent grief, okay, and there is also sadness which is there. But in some remedies, this anger with this silent grief will be more, prominent than the other. Like that, there will be manifestation in the remedies. Okay. So, lot of emotions, more than one emotions in the different rubrics, and there was a psychosomatic kind of expression which was there. Then what was important is trifles. So very small thing. They are very sensitive. So trifles, small things can also affect them, and this is a very important theme in the fact. So you will see in the in your clinic, if the patient will come and say, she says something, and I get very angry. It affects me very badly, and I get angry. I feel like crying. I feel at the same time I am very sad. I want to cry. All this jumbled up of emotions will be together, and a lot of sensitivity will be there. Another important aspect of this family is fright. Fear is something which is very important. Hmm? So, so there will be, the expression will be that somebody is saying something, somebody is doing something, and that is affecting me at a very intense level. Okay. So the basic human emotions which are there, which are those? One is anger, then the fear and the sadness, right? And they affect in this family a lot. Okay, the sensitivity is very high, so they cannot be sustained, and there will be a lot of expression of it. Okay, they will be expressing at the level of course at the bodily level, but also there are a lot of outbursts which you can see in some remedies, and some remedies there will be more of bluntness or suppressed emotion. So you will see pulsatilla is most of the time feeling. It's more of feeling, and then weeping, and then irritability, and then angry, and then all of it together. In Staphysagria, there will be more of anger, but in Staphysagria, this anger is more of what we know is suppressed. It is more to do with the control, right? And Helleborus will become like completely blunt. It is as if create something, a kind of a layer in such a way so that all these things, they don't affect them. Okay, so the expression of blunting will be more prominent in health. Okay, so different sensations you will see in these remedies, and especially in this family. The sharp, stitching, stinging, sticking like pains. Okay, as if the nerves are very raw. There is no insulation. Everything just come and affect. Everything affects. Shock like pain, easy excitement. They are morbidly sensitive. Trifles, morbid, sharp, stitching, stinging pain will affect. Lot of mental emotion. So annoyed, harassed, you know, distressed, and lot of outburst also will be there. Fear also will be a very important part of this family. Hmm. Then what will be the passive reaction? So their passive reaction will be either numbness or blunting. And in a compensation phase, they will say equanimity at the at the level of being calm, nothing affecting, like that will be a kind of expression. And most of it, what we see, they're active kind of expressions, no? So many emotions fell together. So raw nerves, one emotion on the other. Then there will be a lot of somatization, as we express, outburst, brooding will be there. They're easily excited. There can be tremors from emotions, okay, and very passionate kind of emotions we will see in there. Okay, in the recent evolution of uh, Dr. Shankaran's work, he's come up with the idea or the concept of superclubs. Okay, which there is a book which is available for these super classes. It also mentions that there are, as per the 6 subclasses, there are these 6 super classes in which the patients or these remedies belong. And in these super classes, there are all the remedies from all the kingdoms can be there. So in first super class, there would be a remedies from plant, animal, minerals, and hormones, and sarcodes and ozodes would be there. Similarly, in the other 6 subclasses. Okay, so I highly recommend all of you to join and uh, uh, read that book to get the clear understanding and effect of it. And I'm we've been trained, me and Dr. Preeti, we've been trained under Dr. Shankaran sir for this kind of a concept when he was, working on it. And the book is released now, and it is very, very helpful in the practice that I've seen. So some glimpses of it, just to make the the Staphysagria as a remedy clear. Okay, so in first super class, that is the entire super class where there are plant remedies, animal remedies, and other mineral remedies. Okay, so the ranunculates or these magnolids belong to this first super class. What is the main idea of this first super class? That everything what is happening around, it's so sensitive, it is experience at a level of sensitivity, and the response for this kind of a sensitivity or what is happening outside is to go inside. Okay, so the keywords for the super class are withdraw, closing, shut off, do not phase it. And opposite polarity will be on the more of fearlessness, mania, courageous, manic depressive. It is perfectly okay not to understand this, but the idea of showing this is to get more clarity. I highly recommend to read sir's book and attend his lectures. He's working on it, and he's teaching that concepts too. So learn from him would be a good idea. If you see a miasms of Ranunculaceae family and the remedies in our remedy, that Staphysagria, belongs to cancer miasm, and the other remedies with the miasms are disputed. Okay, so Staphysagria is the belongs to cancer miasm. Then, what are the themes of this Ranunculales order? So, Ranunculales order will have Ranunculaceae family. So, it is mainly to do with the sort of sensitivity surrounding the world. They are very naive and very, kind of very simple people, and they're very naive. They're very conscientious that for doing things rightly, acting in a right way. Morality is very important for them. There will be a lot of confusion, losing their way. Then, and need for this ideal existence will be there, that everything should be proper, like morality, everything should be, there should not be injustice, there should not be anything. So very kind of uh, very difficult for them to create these borders, so that things don't affect them. So their idea is of being in the world which is which to which they are very sensitive. Hmm? And in that, there will be themes in different families. Okay, and because of this sensitivity, there's a lot of this, kind of emotions which are flowing, and their development is not so much as per the inner age method of Dr. Gandhi. They are not like developed so much to take up that the sensitivity so much that everything affects them. So there will be a lot of changeability will be there, restlessness will be there, instability of the mind will be there, flooding of emotions, uncontrolled, unformed but strong emotion will be there. So many emotions at a time. They will only not know what I'm feeling, like that. So this was about the ranunculales and little bit about ranunculaceae. Now let's come to our remedy, Staphysagria, which is from the cancer miasm. What is the main idea of cancer miasm? Is to control so much beyond its own capacity. That is cancer miasm. So there's a lot of focus on this control. Everything should be controlled, and there should not be any outer expression, which is Staphysagria, which will be exactly opposite of Naxomica. No? So Naxomica people, they belong to the last subclass, that is a six subclass and six superclass. They are highly developed. So they will also, will be very dominating, and there will be a lot of kind of expressions at the emotional level will be there. But they will be expressing it. They are the leaders. But what will Staphysagria will do? It will withdraw. There will be anger, everything will affect them. They get lot of anger, but that anger, what they will do? They will suppress it, will control it. Why? Because we'll come to it, because it's the main idea of this remedy is, that they want to maintain this, their image, their dignity, their honor, so that the outburst of emotion can show at a different side of the Staphysagria patient. So they are morbidly sensitive. Least things can affect them, hurt them. They can get offended for smallest of reason, and it stays with them for many years. I've seen that one patient. I'll discuss that case now. But so many years, that kind of uh, affection will be there. And then this need to control, they feel a lot of this indignation. They're very sensitive for this insult. They're very sensitive for people humiliating them, people talking them loudly, people talking to them rudely. If you scold a Staphysagria child or a patient in front of 10 people, they will not say anything at that time, but it will affect them so much. There is one symptom rubric like that, that they get there is a scolding in front of the people, or maybe a teacher scolds the child, and it affects so much that he goes home and gets the fever, right? So lot of fear, anger at that moment, but unable to express, control, but go home and get fever. That is a somatization, right? So lot of anger and sensitivity will be able to see. Okay, so as we saw in terms of the Ranunculacea family, all these emotions will be felt at one time. Psychosomatic affections will be there. Trifles will affect them. They will be more of anesthetic effect. They want to control it, right? And they feel a lot of hurt. Yes. And with this kind of a sensitivity and violent kind of control, it's a very good remedy for tooth pain, no? As we know. Why? Because it's these very sensitive kind of emotions, stinging, sticking, lacerated kind of feelings what they have. So it's a very good remedy for all the nerve pains. Everything will affect the nerve. They're morbidly sensitive. So tooth pain will be there. It's a good remedy for that. Good remedy for surgical wounds which are lacerated. Imagine that wound which will have so much of pain. Emotionally also they are very touchy, like chagrin, mixed feelings, mortification, and indignation are the main things of Staphysagria. Dignity and honor. So they feel that they are dignified, and there has to be some respect and honor. Okay, as if they are born, they are a person of this noble birth. Okay, which is which is in their which is not appropriate to their situation or to their where they belong to, but it is in their understanding that kind of dignity. So if you affect their honor, or if their dignity is affected, their delusion is this main. So all the emotions or all the situations or diseases can be coming close to it. So ailment from wounded honor is very important in Staphysagria. I will never lower myself and never be undignified. It's kind of stand strong, will not bend, like this. Never lose control. Whatever happens, I will not lose my dignity. I will talk to them. However people talk to me, I will talk to them politely. I will maintain that dignity of that person. I will control everything, whatever, even if I, you know, feel inside. I would rather die than my dignity is affected. So much control you will see a cancer man. So it is a very good remedy for cancers also. So much of this feeling of leprosyphilitic, psychosyphilitic mainly. This is mainly psychosyphilitic. So, and cancer, maasm, which will be more. So keeping control, suppressed anger. And then there will be one side that control, and one side there will be like piling up. One side there will be the outburst. So there will be outburst of expression, outburst of violent anger will be there. Holding, and then burst like that. So when they lose completely, so there will be one side where there will be one side for of control, and one side there can be completely fail case of Staphysagria where they will lose everything, and there will be a lot of these emotion which will be there, and they will be angry and very violent people you will see. So respect and dignity is a very important theme of Staphysagria. Great indignation about things done by others, or even if they do, they grieves about these consequences, right? Then they feel that people, even if the small words or small, kind of intense words can hurt them, and they feel that they are treated below their dignity, and they will also not let their dignity go down and go up. And there is a lot of this reputation and honor which is important, and they don't want any damage to it. They're very sensitive to what others say about them. Their reputation is very important. They're very noble, and they wins others respect by their actions, by their being. You will come to know. Okay. and it comes very closely to sulfur. So sulfur will have more of this. There will be also there will be ailments from this. No, spawn ailments from, you see, there is sulfur. So humiliation and all that can affect sulfur also a lot. But in sulfur personality, there will be more of a boasting, a foolish pride, will be there. This can come very close to platina also, but there will be more like, queen-like things. There will be more of outwardly expressing their egotism and that haughtiness. Saphysagria will not be like that. Kind of ordinary people, looking very simple, nice, kind of a people, and but they still be with their dignity and walking, with the pride like that. Hmm? Then there will be one this suppressed side. So very strict code of conduct and honor, and is very indignant with himself, and he doesn't want anybody to affect. So suppressed sexual sphere is also there because of a lot of suppression. So there's a guilt and shame will be there. So it is more of a sexual minded. What is sexual minded? That there's a lot of sexual kind of a feeling which are there, but they feel that it's wrong, morally wrong, and they want to suppress it, but it is always there on there. So it means sexually minded means that, and it only just remains there. So what they will do, they'll indulge more with masturbation and some sexual fantasies. Okay, so it will be also very very important part of Staphysagria. Then they, in their head only, they'll make contract with the world that I'm honest, I'm ethical, I will not do this, I'm on time, and they want others also to do and follow the same. So it's all kind of a mono dialogue that, I'll be polite, I'll be nice, and you also have to be polite and nice to me. Okay, so you will see them, when they enter into the train, they'll be very polite. They'll see to it that they are not getting scolded, they are not getting, affected, or they're not getting into a situation where other people are saying something to them. Before that only they will, kind of take all the precautions. Hmm? Right? And if all this which they are suppressing or controlling, nothing works, then what happens? There will be other side of it. And then they'll feel these insults. Imagine the insult, wrong accusation, okay, convulsions from being unjustly accused. You see, physical manifestation, trifles, going to a violent outburst of the mental emotions which are. So convulsions from being unjustly accused, very important. All these themes being, so justice is important. Accused, it is important, and these convulsions are also. So my God, so even if you just, your intention is not, but they will feel inside like, my God, you called me dishonest. It's, that is how they feel it inside. Extremely sensitive to falsely blamed. And there will be a stages when there is control and losing. That time there will be more of a, kind of a physical symptom. So trembling in the anger, voice is lost from the anger. It's very good for Staphysagria. Face red in the anger, weakness after anger, hemiplegia after anger. So much this anger and suppression, and that's leading to the a kind of a physical manifestation important in Staphysagria. Then, and at the other side, they will, anger will be thrown, okay, to people whom they have offended, whom offend them. Then they want to strike them, they want to impulse to throw, and you will see, one side you are like this and one side you are completely opposite, like that. Hmm? And then at the failed side of it, or the uncontrolled side of, they will be, care a damn that what is happening. They will not be worried about their, their reputation or what people will say. They'll get addicted to a lot of, alcohol and other things. And when I was reading Soul of Remedies, Dr. Shankaran sir had, had given an example, the Mahatma Gandhi of India. Okay, and his state, he corresponds that to the Saphysagria state, right? So he was there when the India was ruled by Britishers, right? And there were a lot of humiliation and accusation for dark people, and kind of bad treatment was given. But he was the man who was standing, strong, and with his theme of non-violence, and him being, very simple, just wearing very few clothes, very simple clothes, and going with his own aim and kind of defiant goal that he has decided. And it can, the idea was like, you can beat me, break my goal, but I will not lose my self-respect and dignity. That kind of a attitude which was there. Hmm? And there should not be anything on my character. That kind of a situation was there. And the uh, Mahatma Gandhi's son, sir, has given this idea that the Harilal, who was son of Mahatma Gandhi, was a completely failed site of Staphysagria, right? He was like, because he was there along with Mahatma Gandhi for all the rights, all the movement that he was doing. There were a lot of expectations from him, a lot of dignity and honor, which was coming from the father, and then he wanted to, fulfill that, control, even if there is an anger, or be with it, fulfill the expectations. But at one side, when you lose it, there was a side time when it was completely broken. He went into alcoholism and he died because of his addictions. So these are the two sides of Staphysagria that we can see. And it was given beautifully in Soul of Remedies, and you must read that. Hmm? So these two sides which we saw, and very very good observation that they're very sensitive for reprimanded. They will apologize for everything. This is also written by Dr. Shankar sir. These are his clinical observation. They, that if you're late or missing on a point, they'll be very sensitive to say that, and they will call and see to it that they're not scolded. Hmm? Breaking the queue, injustice, they cannot tolerate that. So that kind also you have to pick up, in the this thing when the patient comes, right? So some differentiation with carcinosin, very close to carcinosin. But carcinosin, the main field, they are also kind of uh, very obedient. They will be very nice, obedient, nicely, very perfectionist, doing things very nicely, and the kind of feeling that we get, no, because uh, what we have, the main feeling of carcinosin is that they're controlled or they're dominated by person whom they are dependent on. So there will be a lot of history of domination by parent or a father or a mother that we will see in carcinosin, right? But in Staphysagria, the main feeling was this insult or humiliation or disrespect or this indignation on the person whom they are dependent on. That is the main difference. Okay. And in carcinosin, they want to keep control in everything, will be present in all the aspects of carcinosin. And here in Staphysagria, it's mainly related to this indignation and insult and dignity is something. There will be more focus of this control would be there. And in the other themes of broad spectrum, if we see in carcinosin, there will be they're very creative people. No? So desire for music, painting, dance will be there. Travel desire is also there. And here there will be more of suppression. Suppressed anger will be there, and controlling anger will be there. Then other remedies which will come very close to this kind of a feeling of dignity and pride are like aurum, sulfur, and platinum. In our materia medica, right? So what will happen in aurum? How these aurum personalities will look, and how you can differentiate from them from Staphysagria. In aurum, it belongs to the, it's a mineral, right? It belongs to the sixth row of a periodic table. Belongs to the sixth superclass as per Dr. Shankaran. So the main theme of sixth row of the periodic table is about responsibility. They are the leaders. So they will be dignified, they will be a lot of pride, but they will be main theme of responsibility, taking up things, controlling them. But they will be very strong people. You will not see them like Staphysagria, where everything is affecting them, right? So their responsibility, their dignity will have a different kind of expression. The expression is like they are the king, you know, king, very duty conscious, conscientious, want to take up the responsibility, doing things for themselves, their family, and then outside also, right? So these kind of forum personalities. Sulfur, it belongs to the third uh, row of periodic table. Third periodic table and the right side of the row of the periodic table, where there will be more of, foolish pride will be there. It's more to show, to get that appreciation, and they feel that, they need to have that kind of appreciation, and it is foolishly expressed. They want to show it to the world, right? And but they are very close to Saphira in terms of this egotism and this ailment from, spawn, or ailments from, um, they're very sensitive. If you don't talk to them nicely or talk in front of 10 people to them. But this will be more of, you know foolish kind of expression, foolish pride kind of expression you will see in Saphira. And in platina, it also belongs to the sixth row. Okay, so it will have those kind of a queen qualities, no? They'll feel like I'm the best. They will, so that extroverted pride will be seen in platina, which is not there in Staphysagria. It will be more like, when you look at them, you will not come to, they're very simple, nice people, and then having that kind of a dignity and kind of a pride. But in platinum, you will see the extrovert. You can make out the way they dress up, the way they are. They're very strong people, and they will be very contemptuous, no, towards other people. So all these things will be other aspects which will be there, which we can differentiate Staphysagria with. Then let's see some differentiation in the same this same subclass. So magnolids, as we were talking about, it will have remedies like opium, piper, nux moschata, of the different orders, right? So in opium, there will be also sensitivity, reactivity. Okay, what is main thing in sulfur? It is sensitivity for this pain and how they can numb themselves. They are very insensitive for the pain and indifferent for the pain. So their action is to become, response is to become indifferent or insensitive to this pain. Then piper. Okay, they are, how they cope up with this pain. They are also very sensitive for the pain and suffering and all of that. But what they do, their response is like diversion. They like to, divert their mind to see, like have entertainment. So much sensitivity, and their diversion will be to sense it in the, maybe in the food, or maybe in the entertainment. That kind of expression. Nux moschata, it is, ekdam above, like it's just in the initial part of this first subclass. So they are very confused kind of a personality. Bewildered, confused, losing their way. They're dull, drowsy, sleepy. Will be there. And in Staphysagria, there will be much of this, as we know, dignity and honor. Okay. Then the differentiation between the remedies of the Ranunculaceae family. What, as if you all remember, I said that, there will be different manifestation of Ranunculaceae themes in different remedies, right? So what we are seeing in Staphysagria is more of anger, which is suppressed, dignity, honor, violent outbursts, two sides, sexual, minded, and all of that. What you will see in Pulsatilla, it's also very close to Staphysagria, but there, if you see them, pulsatilla patient will be more soft, gentle, yielding. They will see to it that nobody shouts at them, and they want to keep everybody happy. And weeping, as we know from Materia Medica, right? So continuously weeping so that people don't kind of, shout at them or scold them like that. Aconite, what is important? Fear, no? Fear of fright remains. So much of fear, acutely felt, and it will stay for long and long, and very panicky and restlessness. And I saw that the some one question was there, if you can read use the remedy for panic. And so fear is an important factor in ranunculus. So if the themes match, then of course you can use remedy for ranunculus family for panic. And in fact, it's very good family for the panic disorder complaints. Then that aconite will be more of expressing this from the acute miles, right? And as we say, Helleborus reaction is to become numb, indifferent. So they will make themselves in such a way that nothing affects them. They'll be in their own world. They'll be more stupor. They will be more like dull. They'll not understand what if you ask them 10 times the question. They will not say. They will keep. We have to repeat the question. We had one patient. Dr. Preeti was treating her. She'll not say anything. Only one. She'll keep staring. She'll not answer. Or if we answer only one answer, one word, and then she will go somewhere else. So kind of numbing numbing themselves and going so much inside that outside doesn't affect them. Semisifugitis is a very good remedy for depression, but it's a restless remedy. It's a tubercular mind. A lot of suffocation will be there. And there's a very important theme in semisifugitis, as if there's so much of depressed and suppressed and sad, that as if that heavy cloud of sadness is there, and they feel a lot of constriction, and they want to get away from that. The main feeling of semisifugitis. So we can differentiate in terms of the what is important and prominent in the patient, with all the background of Ranunculaceae family, with the Ranunculus orders, themes, and plant sensitivity. Okay, and Ranunculus bulbosus is also very, very, it's also a good remedy. We don't know this much, but it's very good. I've used it for these herpetic eruptions, very stinging, burning kind of a pains which are there. A lot of neuralgias. It's a very good remedy. Then intermittent, you will see angers and intermittent pain, which is very important with annuity, and it belongs to the malarial myasm. So these intermittent things come and go. A lot of anxiety is there, post-herpetic neuralgia, and in intercostal spaces, a very specific and therapeutic actually for this remedy. It's very, very, very helpful. There was one patient to whom we were giving pulsatilla for a long time, and it was helping her. All the aspects of pulsatilla were there, and the themes of ranunculus were there, but pulsatilla was helping her very I would say partially, and during any follow-up, one follow-up, she had mentioned that there was some dreams of snakes that she get, and we saw, we wanted to find out a remedy of this ranunculus with this, themes similar looking like pulsatilla, but has a dream of snake, and we got ranunculus bulbosus, and we had given that, and it really helped. So that way, it is very helpful for you to differentiate and understand how we have to come to a similar or find out an exact match. Then, if you see in terms of the rubrics, then fear of high places, fear of homosexuality, impulsive, insanity, fear of insanity, moral affection, want of moral feeling, will be other side of Staphysagria, and very sensitive to moral impressions. Then indignation, honest, injustice cannot support, pride ailments from aggravated, wounded, moral impressions, ailments from spawn, anger ailments from with the indignation, grief which is silent, pent up, lot of indignation, so menses are absent, work impossible if there is an indignation, mortification ailments from. Okay, so these are some important rubrics for it. What are the cravings of Staphysagria of alcohol, juicy things, raw onions, a lot of spices, spicy and sour things, stimulants. The other side they will need, and it's a very good remedy for tobacco addiction. Okay, so therapeutically, it is used for smoking and tobacco chewing as a de-addictive remedy. So they feel I want to stop smoking, but I don't know how to control my crave. You can maybe help this your patient with Staphysagria. Dreams of a lot of anger which is suppressed. Humiliation dreams can be there. Shameful, no, because they are very morally sensitive and sexual minded. So shameful dreams, amorous dreams, you can see in dreams you can see loss of honor, reputation, lot of quarrels. I had that in my case. That's fight and quarrels in the dreams, which they can't do at the conscious level, which they see it in the dreams. So these aggravations from emotions, sexual excess, onanism, then shame, guilt will be there. Good remedy for laceration, surgical wounds, right? An amelioration from warmth and rest. Ailments from financial loss, hemiplegia after anger, paralysis following the anger and insult. You see the somatization. Afternoon sleep aggravates, and a good remedy to produce the disgust for tobacco. Then they have a tendency for cancer, nerves, genitourinary. One of the very important, significant, utilization of Staphysagria is for the urinary complaint, and it has worked really very well. One of my staff here, I'm treating her with this. After every question, she will have urine infection, recurrent urine infections, and typical symptoms that when they're not urinating, there will not be pain. What a burning kind of a pain. So that is very, very important and very cutting, kind of a very violent pain, you see. Kent writes that, a man insulted by someone beneath his station could not react outwardly. He went home sick, weak, and trembling. And there will be a lot of brooding. This kind of a scenario. Okay, so let me see the time. Okay, it's already 8, but I'll just this case is interesting. It is small excerpt from the case, but I thought it will give us the idea and gist of what we are talking about. So in 5 minutes I'll finish that. So 56-year female, okay, she came with complaints of eczema and acidity, and it had a lot of itching, and then with the itching it becomes wet after scratching, that kind of eruptions. A lot of acidity with bloating and headaches are there. And past history, she had a lot of these recurrent urinary infection with typical modalities like burning and not urinating, there is no pain. And then past history is also important. It's important because it can give an indication to this remedy. Present, she might not be there, but those kind of exploration is also important. Okay, so this was the chief complaint. Then she had a lot of issues in the past with her mother-in-law. So what was her sensitivity? That she used to talk very rudely to me, and she was in a kind of a joint family, and the mother-in-law never used to allow her to make any food in the house. And why she used to feel? Because she'll say, you don't touch the food, and if you touch the food I will not eat it, because I don't like the way you make food, and if you make food I will not eat. And what was her feeling? That why she's doing this, why she's talking so rudely to me, she's not respecting. How can she say something like this? I'm not supposed to make food. Why? It is below my dignity to for her to say this. And I used to get very angry, but I used to control. I never used to say things, and it used to be inside. So you see the sensitivity here. Somebody talking rudely to her, something affecting her so bad, going something downward, this dignity going down, respect going down. That was her experience. and this was at this level, right? Then what was her nature? So broadly, if we want to see a patient, then we see what kind of person that patient is. So she's introverted. She likes to work and be busy. hmm, Wants to done things on time. Otherwise, otherwise I'll get angry. I can get angry at trifles, but I'll keep it to myself. I don't want to hurt other people, so I don't say anything to them. And then, but internally I feel very, very, violent, that I'm angry, that I want to hit them. And my husband is also very loud. He talks loudly. We have arguments, and then I feel, why did I marry? I just want to go away, but I'm not able to do that. I just keep things inside. So a lot of anger with suppression, violent anger, which is suppressed and controlled. Hmm? Introverted. Then there was this one very important thing which she said, that how it started. She said that, when I asked, she said that there was an incident which affected her really bad. So her daughter, she kind of had an affair with a guy, and he was not from the same caste in which they belong, right? So they didn't know about this kind of affair, and she was asking, showing her the prospects for the marriage and everything. And somehow that daughter didn't tell her anything. And when all these things were happening, I don't know what was there in her mind of daughter. She went, without telling them, she got married to that guy, and then came home thinking that, I will accept her. When I saw, she said, when I saw her, she got married, and she came in, and when I opened the door, when I saw her, she did that. I was so angry, so angry. That I nothing. My BP shot up. I had a lot of, kind of perspiration. I was trembling, and I just shut the door on her face. I didn't want to talk to her, and it's kind of, how could she do this to me? She's she's not respecting us. What we will say in the community? And it's like, going below my dignity. How can she do this? She's not respecting me. And then it stayed for many years. It's not that, that okay, she got married and then she delivered a baby also. Still, she didn't want to talk to her. She didn't want to, kind of keep any relation, and she actually didn't keep any relationship with her. And and it went for so many years, almost, 6, 7, 8 years, that she didn't even call her, didn't want to see her face. And then when the child of the daughter, she was suffering, and she came to know, and she brought the only the child. The patient brought her daughter's child to stay with her, because there were again some issues with the daughter, that that daughter was not happy with whom she had married. And then eventually, I think after 7, 8, 9 years, that daughter again had some extramarital affair, because she left the husband and she had an extramarital affair. And she kind of, wanted to again uh, see, like, get married. But that guy was not very good, because he was already married. He had kids and wife, and he didn't want to leave her. So she was very angry that why this, daughter is doing again this thing. First she did this marriage, and now the extramarital affair, and then now she got, pregnant because of that, and then abortion, so much of things. And she felt that, that daughter just should die. And I was so violent in my anger, but I just couldn't say. And it is kind of, she has deranged our status and family name doing all of this, and I cannot forgive her. And this was kind of her main idea. Was then it was a long case actually. And this was the main idea what she has, and it has affected her very badly. And dream, she had mothers and mother's dream, and her mother, and a lot of fights she used to see in the dream. Yeah. So with all of this, if you see abuse, okay, anger, a lot of anger, with grief, with indignation, violence, trembling. She wants to be, alone. Then a lot of these dreams of mother fights, and her urinary complaint also I took, and skin complaint, because we cannot forget her chief complaints, right? And which the remedy which is coming through and through was Staphysagria. And with the background of this indignation and this kind of feeling of aninculacy and this thing. Hmm? You see Staphysagria everywhere. So what I'm trying to put a forward a point here is, this way, and she did really well. Her acidity, her eczema, and her other complaint did very well. And and in fact we stopped her treatment after 3 years, and she's in touch, she's doing well. But my point here to put forward is, when we understand our patients from all these aspects, okay, what is the central part of the patient and what is the central part of the remedy? If we match that, and other things will fall in place, and then we select a remedy, it is very important in terms of the results that we get. Hmm? And she immediately felt better and really did very well. So I think, yeah, we gave her Staphysagria first 200 because she had eczema, so I didn't want to give the higher potency. So 200, but eventually I went to Staphysagria. After getting relief, and again for having recurring symptoms, how long we repeat the Staphysagria? Yeah, so we'll have to judge our patients, at what levels, when we see our these Ken's observation, what is the follow-up of the patient, how do we understand that, she's feeling better at the general levels, her mental levels are better, her sleep is better, but her skin complaints are okay, not better, we can wait. Every remedy, if you are very sure you're selected like this from all the aspects, you must wait. Give time for the remedy to act and observe how things are going. And when there is a stagnancy, or if you see there is some aggravation of the complaint, or recurrence of the feelings at a mental and general levels along with the physical level, it's an indication to repeat it. But generally we repeat only one dose, so that it is sufficient when it is a similar. So that.
Ma'am, Mariana is asking, do you give for panic attack?
Yeah, I think I explained that. No, it's, you can, if the as I say, if the central theme match, so the family is very good for fright and fear and acute expressions of it. So we can give. Yeah. Any other questions? Any comments? I hope it was useful. Maybe we'll share the recordings also, so that whenever you all go through it 2-3 times, see what comes up. If there are any doubts, anything that comes up, you can maybe, write to us, ask us. Okay? Yeah, Mohammed.
No.
Yeah, you can ask. You can unmute
You
yourself.
can unmute.
Yes, am I audible, please?
Yes.
Yes.
As you know, in recent advances concerning psoriasis.
Just a minute. I'll just. I was unable to hear you clearly. Yeah, tell me.
Yes, ma'am. Am I audible, please?
Yes, now you
Yeah,
are.
yeah, thank you very much. As you know, recent advances, they are discussing psoriasis and related to gastrointestinal disturbances, especially constipation, as a result of chronic stresses. While we are treating this patient with Staphysagria, does Staphysagria have a concern with those symptoms? For example, the GI disturbances, that does it remedy the GI disturbances and relieves the stress? What is the mode of action of Staphysagria in psoriasis? It is a big question, I know, but if you can help, yeah, I will be glad to hear that. I'm not a homeopath, but I have interest. I have some interest in the field, and so I am attending your presentation. Thank you.
Yeah. So, what I would like to, highlight here, that if uh, a remedy, okay, remedy will have, as we saw, it will have some specific sphere of action. There will be a specific affection, like Staphysagria was important remedy for genitourinary skin complaints and the styes and nerve related complaint. Very good remedy for lacerated wounds and kind of a pains and all. But it's not just limited to it. Okay, if there is a possibility of matching or finding a central idea of Staphysagria in a patient, okay, where it is exactly matching at a level of family, ranunculaceae themes and ranunculaceae order themes with the anger, lot of anger and suppression. If that is the main idea of the patient, then even if there is a, say, constipation or a gastric derangement, Staphysagria will work for it. What we have to understand in the patient, what is the main idea of the patient, what is to be treated in the disease, the main aphorism which Dr. Hahnemann says, that what is to be treated in the disease is important. Where there is a derangement, where there is a out of proportion reaction which is happening in the patient and getting, coming to the physical level of the diseases. So if you treat at that level, there will be much more better results than the just focusing on any particular complaints, right?
Thank
Because
you.
our remedies, if you see, there the therapeutics is a different thing, but if you see, there are a lot of if you see repertory or materia medica also, lot of our systems, you will find some information available. But what is important is the central disturbance, okay, which is happening in the patient, which should be an idea of the remedy and patient both together. Then it will be better helpful.
Thank you, ma'am.
We have a few more questions.
Yeah. So yeah, Staphysagria is very good remedies for styes and very good because there's a lot of this internalization. So the styes are very important, and eye complaints. So a lot of irritation, inflammation, and kind of infections of the eyes and styes are one of the very important indication. Please guide for how to study remedy like this, how I showed. And we are doing this ABC of remedies for this purpose only, so that to make you understand how to study a remedy. And books, there are so many books which are available. We never should forget our basic books. Chronic diseases by Hahnemann, Materia Medica Pura, Herring's Guiding Symptom, and then over it, Morik's Materia Medica, Fatak's Materia Medica, books by Dr. Shankaran Sarvak, books by Dr. Mahesh Gandhi, and by Mikhail Yakir. She has also written a very good, wondrous plant book for all these plants to understand. And we did the entire 1 year course for in-depth plants. So a lot of books which are there. So our idea is to to show or to make our mind in such a way so that we see the remedy from all these aspects. See, can you differentiate the sexual sphere of carcinosin compared to Staphysagria, shame and guilt? So basically, Staphysagria is more of this controlled sexual feelings. It's mainly this remedy comes to this adolescent, early childhood kind of age, right? So there's a lot of the sexual fantasies and sexual ideas are there, but they are all suppressed, right? So this will be more prominent in shame and guilt in Staphysagria, but in carcinosin it will be more of controlling these, will not be very prominent. There'll be guilt and all, but it is more to do with themselves, that how much they take up things so much beyond their own capacity, and doing those things and being perfect in them. So that will be more expressible along with the other aspects of carcinosin. DD of natrum mur and Staphysagria and dignity. So in natrum mur, if you see, it is a remedy from the mineral kingdom. It is from third row, so of the periodic table. So it will have the issues of love and care and affection and nourishment, and basically they want they want to uh, have a bond or a connection, and people, romantic kind of a relationship in there, like complete dependence. They belong to the first column of the third row, so complete dependence on that individual. And but their main idea is they get betrayed, or their trust is broken. So main important theme of natrum is trust. That trust is broken, and then when this trust is broken, they feel this betrayal and this disappointment, and then they are unable to trust other people, or they don't want to connect with other people. They will be more with themselves. But in Staphysagria, it will be more of sensitivity and reactivity. Natrum what I saw, they will be also introverted and kind of within themselves, but the other themes of natrum also will be prominent in a patient. Okay, Ignatia with Staphysagria. Ignatia, if you again see, Ignatia belongs to the sixth subclass, Asterids of the plant kingdom, and sixth superclass, and it belongs to the Loganaceae family. So the complete difference will be here at a level of the family. So main sensation of Loganaceae family of this shock and kind of a grief which is there, and there is complete numbness or a paralysis of this kind of shock, right? So that will be more prominent. And Ignatia, you will see, they will be more, they belong to the sixth subclass. So they are very highly individual, developed individual will be there. They will be strong, but they at the same time they are controlling. They're doing their own responsibility. And in Staphysagria, you will see they belong to the first superclass. So they will be more mild, yielding, and naive kind of personality. So I think that will be more, and they want to you will see that kind of a control more in the Staphysagria, because it is, they want to do it at a very deeper level, and they are very sensitive kind of thing. But with Ignatia, it will be more and more deeply in their subconscious level. This ABC webinar we conduct, monthly we are doing it. How to identify the person's kingdom, and some symptoms are for the plant while some of the animal, and so to do with mineral group. It is a very theoretical question. I think this is mainly to do with what is the importance in the patient language, how the patient is talking. I can maybe explain that with the cases. In this patient, we saw there a lot of sensitivity which was there. Everywhere, this affected me, that affected me, and this is my reaction. My reaction was anger. So everywhere centrally, when you see sensitivity, it's a plant kingdom. But there is possibility of this thing, but I think this will be more be explained in the terms of the cases. Yeah, I think that's the end of the questions. So thank you all of you for joining, and I hope to see you all in the next our ABC of Remedies. We'll come up with another good remedy. Okay. So yeah, Raskin, if you can, share a link, and
Yes,
I think
ma'am.
it will be helpful, and spread the word so that, people can learn and they can understand the remedies, and more, clarity and surety of the remedies when you see these patients in your clinic. Okay. So thank you and bye bye. Have a
Thank you so
great
much, ma'am.
day. Yeah. Bye.